Hi, it's Eva. Tonight I'm going to be going over what I couldn't finish last week because the list was so long, cluster B personality disorders. And then I'm going to finish it off with talking about the dark triad, which would be narcissism, Machiavellianism, and psychopathy all mixed together. So we'll do that at the end. But first, I wanted to go over what these terms kind of mean. I'm using the DSM-5. And cluster A is really more about sort of odd and eccentric personality disorders. So you have paranoid personality disorder, pretty obvious what that is, schizoid, and then schizotypical. And then cluster B, which is what I'm going to be talking about, is they call it not officially, the dramatic unpredictable cluster. So that's antisocial behavior, histrionic, borderline personality disorder, narcissistic personality disorder, and borderline personality disorder. And then cluster C would be the anxious and fearful type disorders. So you have OCD in there, obsessive compulsive personality disorders, what it's technically called dependent personality disorder, which is obviously kind of like pathological codependency, I suppose. Avoidant personality disorder, which gets a ridiculous amount of press, and there's several breakdowns of that, but I'm not gonna get into those. We're gonna be into cluster B. All right, so I'm pretty sure I touched on borderline personality disorder. It's very common. Sometimes it's mistakenly thought to be bipolar 2, which is, to me, they're really different, but I guess the moodiness would be, erratic moods would be the reason somebody might misdiagnose it that way if they weren't a professional. Really, people who have borderline typically have had abandonment issues in their early life, childhood, or early adolescence. It stems out of oftentimes just wanting that attention from that parent they didn't get, or both of them they didn't get. So it's like they're seeking attention in a kind of almost like aggressive way. And they'll use all kinds of, coercive behaviors to draw that out of whoever they're dealing with. So they could seemingly change their mood quickly. And the reason they do that is because typically when you're like saying goodbye, or they're not getting to go somewhere, or there's some things being taken away, it's like they have a poor ability to sort of deal with transitions, and they'll become very like triggered and almost be in the state of how they were as a child, only they're now an adult. So it looks dramatic because it looks like a toddler having a fit, really, but it's a grown adult. And there's actually valid reasons why they're behaving this way. It's not because they're just acting up or trying to get their way. It's like to actually have this disorder, I think, would be very disruptive to your daily life. I think it would be really hard to keep a lid on all the different feelings you have and be able to clarify for yourself immediately that this is something that's happening here today. Like this has, this is nothing to do with how I was back with my parents, like this is a different situation. These are actually my children, So it also is really hard to treat. Oftentimes they use something called dialectical therapy, which is a lot more intensive between the therapist and the patient. Like, it's almost like they have to do a rapid fire, like, back and forth, instead of just like the patient just sitting there and the therapist writing notes and the patient just talking about their lives. It's not like that. You're not analyzing the past or anything like that. What you'd really be doing is bringing up, like, maybe an active scenario, like when, I don't know, when my mom came over to pick up my daughter, I got upset because this and that, and then you would deconstruct it together kind of aggressively, like just trying to instill like would have been the appropriate behavior, and then maybe like discussing what the first thing that comes to their mind is, which is usually something that's inappropriate reaction to what's happening. And oftentimes, because you have to be specially trained to do that, a lot of times it'll be like a group session instead of one-on-one, which is not good because, like, really a lot of times people with this disorder also are not great social. I mean, they're good socially, but they usually prefer not to do therapy in a social setting. So that's problematic. It's more like a funding issue than anything else. All right. There's no specific medication that really deals with that. You just have to, go through the usual ones for anxiety and depression. But it's definitely more anxiety with that disorder than, I would say, depression. Bipolar 2 would be where you would go through many episodes of having mood swings that go in a very particular order of how, the high and the mania and then the crash. And bipolar 1 has often hallucinations, auditory at least hallucinations involved with it, and the periods are much longer of the mania. The other one's called hypomania, I believe. Shorter episodes. All right. Then histrionic, I think, is a really less common one, or maybe it's a less diagnosed one, where you have almost like an attitude of like you always want to be the center of attention. You feel more comfortable being sort of like the one telling all the stories, the one everyone's looking at. That like sometimes he'll dress in like more sort of seductive ways to get attention. It's I'm trying to think what other disorder it's like. It's less erratic, like with borderline. These are like quick on and off for the moods, and I think with histrionic it would be more like for a period of time. You're acting a sustained period of time. You're drawing attention to yourself, and sometimes this person may be just called a social butterfly, or they may be popular until they're inappropriate, and then they're not. It's been diagnosable for a long time. The other one, antisocial personality, is usually something that it can't be diagnosed until you're over the age of 18. I know that. Okay, that's really significant. A lot of children will get diagnosed first with conduct disorder, which means, like they're not conducting themselves in public that well. They're having defiant behavior, rebellious behavior. There may be vandalism. There may be stealing. There might be pyromania. There may, all kinds of things that are inappropriate. There's just basically like breaking the rules, not having any regard for not just other people, but society in general. And they're often people who are, I would say, keep to themselves, but more like they're not. I'd say sometimes they don't fit in, that they're a little bit out of the main popular group. They get very fixated on things. And I would think the most important criteria for antisocial is that they're impulsive. They always act before they think. Like, they may just come up with an idea to go rob someplace or do something that's considered, kind of reprehensible. And it, like, if they really thought it out, it's like, well, that plan wouldn't even really work, honestly. Like, if we go to this gas station, like, there's going to be cameras, like, they just don't think things through. And they have a really hard time sustaining their attention to whatever the conclusion would be, or like they have a really hard time like keeping in their mind like what would be the fallout of that, what would be if we were caught, like what would happen. Like, they don't think that far. And so a lot of times it makes it easy for them to get caught because their plans are so last minute or not well thought out. Of course, they're violent and erratic. A lot of times they have intermittent explosive disorder somehow tagged onto their record in early adolescence, kind of like maybe preteen years. Or that gets tossed around as like behavior issues, behavior being something you choose to do, whereas psychiatric condition would be something that, or personality disorder is more considered something that you don't really have control over. It has to do with your genetics. It has to do with the environment you were raised in. Most definitely has to do with abuse and neglect you've been put through, dirty environments, been around substance abuse, parental figures, or alcoholism, or they tend to have a lower IQs, not significantly lower, but on the lower. Whereas bipolar, I think bipolar is the one that has the highest IQ rating. And schizophrenia usually is a high IQ as well. And so antisocial behavior, once you get slapped with that at 18, it's quite a label. That's why they don't want to put that on someone who's under 18, because it would really stigmatize them. All right, I think I went through all of them. I think that's it. All right, I'll take a break.